Bienvenidos al CSC 2019 y al plató de Endovascular TV. Para mí es un placer hoy presentar y estar con el doctor Luca Testa, hemodialamista del Hospital San Donato de Milán. El doctor Testa es probablemente uno de los hemodialamistas más relevantes de Italia y es un experto en muchas técnicas, pero especialmente hoy nos sentamos con él para hablar de los balones con droga, de los drug coating balloons. So, Luca, very welcome to our meeting. Thank you for coming.
It's my pleasure.
And we want to talk today about drug coating balloon. Drug coating balloon is an old technology. It's not new, in fact.
Nope.
But the technology has evolved over these years. What can we expect from drug coating balloon today?
Thank you for this kind invitation. And well, of course, we have been observing a lot of improvements since the introduction of this technology. And I have to say that the concept behind is very simple, because there are some limitations, related to the concept of metallic drug-eluting stent. And the DCBs are actually aimed at resolving these problems. In particular, I have to say, looking at the guidelines, we can see that there is a class 1A indication, and there is a reason. This huge amount of data produced in the last year. What we can expect, well, it's probably hard to understand and anticipate, because we are actually using in a lot of patients these new technologies, because in particular the concept of positive remodeling, the concept of leaving nothing behind is something really intriguing, I have to say. And again, to overcome the limitation of DES, we do not want to use a lot of metals in our patient. We prefer to deliver the drug in order to really and effectively act on atherosclerosis without all the inflammation related to the metallic stents. And this is probably something that we will see even more in the future in the large amount of patients.
It's interesting that in the last years we had some newcomers in that market, and one of them is the RESTORE balloon, and we got some very interesting data from China, which is in two fields. One is in stent restenosis and the other one is small vessel disease. You should start commenting about the stent restenosis.
Well, I have to say that the scenario nowadays is actually really crowded, because there are a lot of players in this field. And I have to say the RESTORE drug-coated balloon is probably will be able to play a major role. In particular, we have seen these two trials, separate trials, one aiming at understanding what is the risk-benefit effect and profile of this new paclitaxel-coated balloon in the ISR. And then there is another trial just published last year, actually aiming at assessing the risk-benefit profile in small vessel disease. I would like to start from ISR, which is one of the main indications for paclitaxel-coated balloon. And I have to say that starting from all the rumors coming from the US, we are all actually worried about using paclitaxel nowadays. But this new technology that has actually completely different features as compared to other balloons is probably able to provide the highest safety possible, as well as a very good profile in terms of effectiveness. The RESTORE ISR was randomized controlled trials comparing the, let's say, blockbuster in terms of paclitaxel-coated balloon and the RESTORE drug-coated balloon, and the result was very easy to understand and very nicely achieved. There is no difference in terms of target lesion failure, late loss, and 9 months in patients treated with the RESTORE or with another paclitaxel-coated balloon, I have to say. And this is the very first randomized controlled trials assessing the effectiveness of two different devices in more than 200 patients. Talking about the small vessel disease, there is this other trial published last year as well. Well, actually, the RESTORE DCB has been compared against the Resolute DES. And the result, again, are very encouraging, because there was no difference in terms of late loss and 9 months follow-up. And all these patients, more than 200 patients, has been compared in a randomized fashion, one-to-one randomization. And then at 9 months, there was no difference between the RESTORE balloon and the Resolute Onyx. So, very good news, I have to say. So we'll see what is the real role of this new player, but I have to say that the data that we have so far are very encouraging.
Yeah, one of the problems with small vessel disease is that we got all trials comparing drug-coating balloon with a Taxus stent, which is not anymore in the market. So one of the requests, but at the industry was, why are you not doing a trial with drug-coated balloon comparing with actual stents? I mean, with the present stent, with modern DES stents.
Yeah.
So one of the trials was this trial.
Yeah.
And there is another one, which is the basket small 2 trial. So, and in fact, this trial is a little bit complementary to the other one. So can you comment on that? And then the big question, do you think that the results that we have observed will promote changes in guidelines in the next future?
Oh, well, that's a question. Well, definitely, the scenario nowadays is, I would say, very reassuring, because whatever we say, whatever we believe from the trials, the data are actually going in the same direction, because nowadays, and again, even according to the guidelines, the class 1A indication for small vessel treatment is something that will become even more common in our cath labs. And I strongly believe that particularly for those patients with diffuse disease, long distal disease, the technology of drug-coated balloon will be probably the most important approach in the future. It's hard to believe now that it will be probably very homogeneous throughout the different countries, because of course there is a difference in terms of definition of small vessels, as you perfectly know.
Absolutely.
Because what is small for us maybe can be different for other ethnicities, coming from the Far East, for example, coming from Africa. We don't know what is the real answer, but I always say one size doesn't fit all. We'll see in the future, but definitely I'm pretty sure that nowadays we have a large amount of data, and this data must challenge the guidelines in terms of what is going to be the new recommendation for the next guidelines. And I have to say, next guidelines maybe will be released in 2 or 3 years' time. So there is still a lot of time to collect more data.
I'm a fan of the drug-coated balloon. I have been working in the last 15 to 18 years. It's an old technology, and I have produced some data on that. And so I'm a fan. I know that works. And now we have new data proving that the concept is valid, that the concept of leaving nothing behind is very, very attractive.
Yeah.
But we have a problem, young people. Young people want to put a stent. So what can you say to the young guys that will succeed us in our cath labs to promote the use of drug-coated balloon in those scenarios that you were talking, that this is maybe not the best option to use drug-coated stent, as small vessels, etc.
Well, I have to say that I totally agree with you. I mean, we have a problem because our younger colleagues would like to put a stent everywhere, every time. And I also have to say that available technologies are so good that you can reach distal lesions and vessels that was impossible 5 or 10 years ago. But at the end of the day, I always say what we can do sometimes is not what we should do for the health of our patients. So the fact that we can put a DES in a very distal and small vessel doesn't imply necessarily that is the good thing. So in other words, we need to think long term. And in particular, the concept of positive remodeling, the concept of reducing the inflammation, the concept of reducing the late loss is something we need to teach to our younger colleagues in order to let them understand that sometimes the DES is not the right choice.
And to achieve this, do you think that we may reinforce technical aspects with drug-coated balloon? Because sometimes you see that people is not applying drug-coated balloon in the way that they have been designed. So you cannot use it without predilatation. You have to employ a step-by-step procedure, which is simple, but maybe it's time to say, to use those DCB, you have to follow rules, and then you have a good result. Which are the rules for you?
Yeah, I mean, I have to say that we need to clarify one simple concept. The drug-coated balloon is actually something made to deliver the drug. It's not a balloon made for predilation, post-dilation, or whatever. So in other words, we use this technology just to deliver the drug where it's needed. So we need to teach our younger colleagues that the drug-coated balloon is the very last step of our procedure. Well, unless there is dissection or complication. But I have to say that in terms of flow chart, the drug-coated balloon is the very last thing. We need to go back in time, preparing the lesion, inflating the balloon, using a 1-to-1 ratio balloon for the pre-dilation. Sometimes we need to use the bulking devices, but at the end of the procedure, we can think about a DCB to deliver the drug where it's needed and leaving nothing behind. So in other words, we need to go back in time, meaning that we need to teach again how to work on the lesion before anything else, and then we can use the DCB. If we do not respect all the steps, the DCB will not as good as you think.
So, Luca, thank you very much for this interesting
You are very
talk
welcome.
about drug-coated balloon, and I hope you will enjoy the rest of our meeting.
I'm sure I will.
Thank you very much.